deliver radiation therapy to a patient is actually a very involved process. Even for just a very simple plan to a very complex plan, we have a lot of different people that specialize in various aspects of that. And so we get to work with people both within our department and outside of the department as well to create what we like to see as the best possible radiation plan for the patient. One of the unique things about what I do specifically in the GU cancer space, specifically with prostate cancer, is that it's individualized patient care. You get to learn a lot about what patients value, what their goals are, what they want for the future for themselves and for their family. And then you get to kind of cater the treatment towards that. And then there's a number of different treatment options specifically within prostate cancer, which is really, really nice. And then in general, also as far as, trying to understand the kind of individualized nature of a patient's care plan or what they want out of their care. One of the things I've noticed the most is to actually kind of just take a step back and listen and hear what the patient's saying. Because if you throw a bunch of information at them all of a sudden without letting the patient speak, it's tough to kind of process all of that. So that's kind of one of the ways that I like to try and be there for patients as they're navigating kind of the difficulties of this process. So when I was in medical school, really already knew about radiation oncology. Actually, my dad is a radiation oncologist and he trained here at WashU as well. And during medical school, I was evaluating various different specialties and also considering, my dad's specialty. And ultimately, felt that it was kind of the best combination of kind of all the best parts of medicine. You get to deal with patients, you get to deal with technology, you get to involve yourself with other disciplines and talk to other doctors around, the hospital system about patient care, and get to do a lot of really cool things as far as procedures go, imaging evaluation and those kinds of things. But I really felt it was kind of the best fit for me. And then ultimately my dad being in the field as well helped make it even better of a fit. So when I meet a patient for the first time, I first start by introducing myself and telling them kind of what I've heard about the story and kind of seeing how they're thinking about things. Do they have any idea of kind of where they want to go from here? Anything that they've read online that may be shaping their thoughts right off the bat? And then kind of saying that let me hear those out so then we can address those as they come up. So GU is kind of genitourinary oncology, so specifically focusing on things like prostate cancer, kidney cancer, bladder cancer. A big scope of my practice is prostate cancer, and then a growing scope is kidney cancer as well. We're also interested in treating bladder cancer. There's data to support using radiation and chemotherapy to help preserve the bladder for patients with some bladder cancers. And so that's one of the things that we're wanting to develop as part of our program as well. And one of the reasons why I chose GU radiation oncology specifically is there's a nice mix of kind of individualized patient interaction as far as conversations go, but then also there's some procedures involved. We get to talk a lot in Tumor Board about very complex cases, and we work with a lot of different specialists, including medical oncologists and urologists, and the team here is really great. And so I've really enjoyed working with them, and it's been a great experience so far. I always say that kind of one of the most interesting things you can learn about from cancer patients is their resilience and their fortitude to move forward. And then when they come back after their cancer treatment is finished, and then they kind of thank you and they're so grateful for the care that you provided and that your team has provided, it really makes you feel good inside and really makes you feel like this is kind of the reason why we're doing this sort of work.